Good morning, guys. I hope we're all sparkly. It's safe to say that we're just a bag of chemicals, and our consciousness is the subjective appreciation of subtle changes in physiology, how your body functions. Testosterone is key. Testosterone is fundamental to health. Not only is it necessary for anabolism, growth and repair, but it's necessary for this, mental well-being, because of the relationship with dopamine that we've spoken about before. Earn your reward. So, low testosterone is a miserable state. Normal testosterone is a normal state. High testosterone, actually, paradoxically, is an uncomfortable state. Well, why is that? Well, you're too wound up. You are dialed up to 11, Spinal Tap. With testosterone replacement therapy, what happens? Well, your dose is carefully titrated according to effect to get you where you need to be for normal physiology, how your body functions. It is dialed up to 10. You've been dialed to 4, it's felt pretty rubbish. We've got you on testosterone. We've had to play around with the dial because it's not as simple as just, this is your dose, this is the effect it's going to have. Go forth and prosper. No, your dose has to be carefully titrated according to effect to get you where you need to be. Because what's it all about? My favorite word, balance. I say balance. If you had a drinking game, I had to balance was the word. My God, we'd be plastered. Balance and an appreciation of contrast. So the opposite of testosterone is what? Cortisol, your stress hormone. Do we want stress hormones? Yes, of course we do, but we want the right amount. We want everything to be in equilibrium, and we want everything to be determined by what we do, not what affects us. But we are the subjective appreciation of change. So yeah, it is encompassing, all encompassing. It is a wonderful, wonderful, crazy world. But we have to try and make sense of this crazy world and find meaning and purpose in a world that doesn't have meaning and purpose, because we've reached utopia. But we have all these same drives that force us to survive, but we're lost in this weird world. So we have to make sense of the madness. Now, I've not been feeling very well recently. I had an operation. I had a septorhinoplasty, uvulopalatopharyngoplasty and graft mid-December to correct my sleep apnea. And yes, it's worked. But my word, I haven't been my own best friend, as my mum says. Because I can't stop. Why can't I stop? Well, it's partly my mentality and partly because testosterone has me dialed up to 10. The prof said, take at least 2 weeks off, Rob. I said, I can't. How about a week? And he goes, Rob, honestly. So I took a week off, sort of, and then I hit the gym and I maxed out as much as I could do without feeling absolutely awful. But I wasn't fully recovered, and I shouldn't have done it. Why did I do it? Because I have this nobody cares, work harder attitude. And yes, it does work when you are balanced, when you're not ill, when you're getting good sleep, when you're getting good nutrition, and your mindset is right. Now, we said that we're physical beings in a world full of psychological stress, and we release the same neurotransmitters as we do with physical stress as we do with psychological stress. But we're physical beings. So the psychological stress essentially breaks us down. So we have to be super diligent about the things that we talk about. Stress reduction, mindfulness, ice baths, saunas, grounding, all of these amazing things, they have to be implemented to make sure you're not going to go crazy, because everybody's crazy in this world, aren't they? So again, what was I doing? Well, I was doing all the stupid things. I was training. I was getting back into my ice bars. And I've just said ice bars are great, and they are great. But what are they? They're a stress response. They elicit a stress response to actually prime your body so that when you do have a massive stress, you cope better. But if you're not very well, you shouldn't be having ice baths, because it's another stressor. And your body should be concentrating on getting to back to normal by dealing with the stress of illness. So yeah, I was a plonker. I was rebuilding. I was doing saunas. Again, placing my body under an incredible amount of stress. Foolish, yeah. But now I'm more considered, because time is about what? Time is about now. Not about yesterday, not about tomorrow. Considerate of the past to be considered for the future. Yes, now. So yeah, I've been stressed and I desperately need to get back into the hills. Why? To get away from the madness, to have purpose, to get to a destination and fulfilled. Because I love my job. I absolutely love my job. I'm affecting a positive change to the patient. The primary reason why I do this job is you. I also feel good from making you feel better and normalizing your hormone levels and giving you that realistic expectation to go forth and prosper. But ultimately, it's all about you, because what is it? We're one consciousness experiencing itself subjectively. But it's incredibly stressful. So most people, they have jobs that they don't particularly love. And that's incredibly disappointing. So what do you do? Because time is right now. Well, you have to think about why you're working. You know, we said before, we're finding shelter, food, hopefully getting a bit of nookie. So yeah, we need to work and to present ourselves as the best version of ourselves, as I said way too many times in the last video. Because we have to keep going. It is all about keeping going. And low testosterone, you don't feel like keeping going because you have low testosterone, low dopamine, and hence the reward neurotransmitters missing. So you just sit in this purgatorial state. So it is utterly miserable. So again, making sense of the madness, you have to keep going. So yeah, work can be miserable, but it shouldn't be miserable. As Alan Watts said, if you're a dishwasher, make a game of it, play with it, make that dish the most important thing in the world, so that you have a sense of pride and achievement from making that dish clean. But enjoy it, absolutely enjoy it, and have that appreciation. And you need hormones to do that, because they provide a level of chronicity to allow your autonomic nervous system to react acutely, to then allow your reactive brain to perceive all this thing as what it should be, a wonderful game. Life is just a ride. Again, another wonderful Bill Hicks quote. So yeah, providing that level of chronicity to allow you to appreciate this change that happens on a day-to-day basis. So testosterone deficiency is a miserable state. So testosterone replacement therapy is the cure, but you are dialed up to 10. Now remember that. Now what happens when you get ill? Naturally. Well, your testosterone levels are going to drop. Well, why are they dropping? Well, they're dropping because they're helping fight the infection. But what does that translate into subjectively? Well, you don't feel very good. You don't feel very good because of the infection, but you also don't feel very good because your testosterone level drops. Now, what does testosterone have a relationship with? Dopamine. So what are you less likely to do? You're less likely to go out and hunt. So remember, guys, have man flu. Man flu is really serious. So what happens with man flu? Well, we're knocked off our feet because we're not supposed to go hunting. We are supposed to recover. Because what's it all about? Restoring balance and equilibrium. So with testosterone replacement therapy, you don't have that decrease in testosterone, not really because you're ill or because you're overstressed, but you're always dialed up to 10 or 11 if you like the Spinal Tap reference. So yeah, remember, you have to be more considered about everything that you do. The psychological stress that you are experienced or subjected to can make you feel even worse because you are not dealing with it effectively. You're not taking a step back and being objective. And it's incredibly important to take a step back and be objective, because what do hormones offer? Again, that level of chronicity to allow you to be more considered. So be more considered. Now, you're desperate to get better. And yes, we're all desperate to get better. And there is no destination. The destination's an illusion. We're constantly working to get better. But apply that level of objectivity to your subjective experience, which is incredibly challenging, which is why my job is so rewarding, because it's not just about titrating your dose according to PhET to get you where you need to get to. It's the fact that I've seen over 4,000 of you, and I can provide you with that level of objectivity in your subjective experience. But you just need to trust the process. So again, when you're not dialed in, you're not dialed in. And I will tell you you're not dialed in. I will say, listen, I think we should do this, but it's not going to be an overnight cure. It's going to be 4 to 6 weeks before the levels settle, and then your physiology has to adapt again because you're dialing yourself up artificially and your body then has to adjust. So this is not a quick process, but it's 100% worth it. TRT can be life-changing. In fact, it can be utterly life-saving. But you have to trust the process. You have to understand that ultimately, it's all down to you. I can provide you with the tools and the foundation, but it's all down to you. And it wouldn't be worth it otherwise. So yeah, take charge of your own health, because when that goes, you've got nothing left. That wonderful sports car is irrelevant. That lovely house is irrelevant. If you don't have your health, you have nothing. The Dalai Lama said, what is the most peculiar thing about mankind is he sacrifices his health for wealth, and then he spends his wealth to regain his health. Take charge and do what? Go earn your reward.